In the name of Allah.
The presentation explores the potential of mesenchymal stem cells in treating multiple sclerosis. It questions whether this approach is merely hype or a hopeful breakthrough, outlining key topics such as MS epidemiology, risk factors, and stem cell applications. This map illustrates the global epidemiology of multiple sclerosis in 2023, highlighting prevalence rates per 100,000 people. It notes that 2.9 million individuals are affected worldwide, emphasizing the widespread impact of MS. Multiple sclerosis is an autoimmune disorder affecting the central nervous system. This slide explains how MS leads to chronic, progressive damage to nerve fibers, impacting their ability to transmit signals effectively. The activation of myelin-reactive T cells in MS involves an imbalanced immune system and increased intestinal permeability or leaky gut. These factors contribute to inflammation and disease progression. Gut microbiota plays a crucial role in immune system education and maintaining blood-brain barrier integrity. Imbalances can lead to autoimmune diseases, with MS patients showing reduced gut bacteria diversity. Viruses, bacteria, and food components can trigger MS through molecular mimicry. Myelin proteins share similarities with these agents, potentially activating the immune system and exacerbating MS symptoms. Risk factors for MS include genetic predispositions and environmental influences like smoking and vitamin D levels. These factors can disrupt immune regulation, leading to increased autoimmunity. MS treatment aims to reduce relapse frequency and severity, slow disease progression, and manage symptoms. Common treatments include corticosteroids, plasma exchange, and various immunomodulatory drugs. This slide introduces stem cells, highlighting their potential to transform into various cell types. Stem cells are pivotal in regenerative medicine, offering hope for treating degenerative diseases like MS. Stem cells are unique for their ability to divide and specialize into different cell types. They play a vital role in growth and repair, making them a focus of research for regenerative therapies. Stem cells provide new cells for growth and replace damaged or lost specialized cells. This regenerative capability is crucial for maintaining tissue health and function throughout life. Stem cells have potential in medical treatments, such as treating leukemia, diabetes, and spinal cord injuries. They can replace damaged cells, offering new avenues for healing and recovery. Stem cells are being explored for their application in treating multiple sclerosis. Their ability to regenerate and repair damaged tissues offers promising potential for managing MS symptoms. Autologous hematopoietic stem cell transplantation, AHSCT, involves several steps, including stem cell collection, chemotherapy, and reinfusion. This process aims to reset the immune system in MS patients. Forest plots show the pool prevalence of improvement in MS patients following mesenchymal stem cell therapy. The data suggests varying degrees of success across different studies. Clinical trials are evaluating the effects and side effects of mesenchymal stem cell transplantation in MS. These studies aim to establish the safety and efficacy of this innovative treatment approach. This trial investigates the efficacy of autologous mesenchymal bone marrow stem cells in active and progressive MS. The focus is on the immune modulatory and neurotrophic effects of these cells. Biomarkers of ASCC are being studied to improve disease control in autoimmune neurological conditions. This research aims to enhance the effectiveness of stem cell transplantation in MS treatment. A Phase 3 trial in the USA compares the best available therapy with autologous hematopoietic stem cell transplant for MS. This study seeks to determine the most effective treatment strategy. A Swedish study assesses the safety of a single IV infusion of autologous mesenchymal stem cells in progressive MS. The trial focuses on protocol standardization to ensure consistent results. A Spanish study evaluates the safety and feasibility of using mesenchymal stem cells from adipose tissue in secondary progressive MS. The goal is to find effective treatments for non-responsive patients. Promising MS research areas include targeting the gut microbiome and gene therapy. These approaches aim to treat, prevent, or reverse MS symptoms by addressing underlying biological mechanisms. The conclusion highlights the potential of mesenchymal stem cells amidst public hype. Advances in cell biology and engineering could lead to breakthroughs in neuroprotection and MS treatment. Thank you for your attention. This concludes the presentation on mesenchymal stem cells in multiple sclerosis. Please feel free to ask any questions you may have.